name's Joyce Gibb. Thank you so much for being with me today. Frequently, I've been getting a lot of patients that have had hives. And hives is basically a histamine response. A lot of this information today is coming from an article from Todd Watson, Jay Davidson from Cellcore Biosciences. So you can get hives for many reasons, and I'm just going to go over like the pathophysiology of hives and why you get hives. So the first thing is you have to realize that the histamine response is typically what happens when you have hives, and that is actually the body's natural response to a defense. So, and someone's exposed to an allergen, whether it's dust, mold, food, etc., and your body develops this allergen response to get rid of this invader. So when triggered, mast cells are actually the response is mast cells, and the mast cells erupt out of the cell, and that causes a runny nose, watery eyes, can potentially be cough, can even progress even further for anaphylaxis and death, which of course we never want that. But many people correlate mast cell activation with asthma, because many times asthma is triggered by actually an allergen response. You can have allergic asthma, or you can have asthma as a response when your airways close down for whatever reason. So histamine intolerance happens when the histamine response builds up. It's almost like the water's going over the bucket. There's a level to where your body can tolerate it. Then after that, the response happens and you have too much histamine your body can't get rid of, and that's when you have watery eyes, cough, runny nose, sometimes swollen lips, and wheezing, etc. So symptoms appear to come from food or beverages that are naturally high in histamine, and then the mast cell activation syndrome happens when you have too much histamine. So people can have repeated anaphylaxis to this. So that's why you say, if somebody gets stung by a bee or you eat peanuts, those two things can have mast cell activation response, and that can be deadly. So what's the typical treatment for that? People say to go ahead and take Benadryl. What is Benadryl? Benadryl is an antihistamine. The other antihistamines that are out there are they're longer acting, which are, several of those. And so they can be 24 hour, 12 hours. And, Zyrtec, Claritin, Allegra, the previous prescription drugs. Now those are all over the counter. But dust, pet dander, mold, and a lot of kids with asthma that live in homes that are infested with cockroaches, etc., they actually have asthma related to cockroach dander. So, but it's itchy, sneery, sneezing, tearing, just those type of things that can happen with that. So what allergic reactions happen? And first of all, like I said, it's the immune response. It sees the allergen. Chemical signals are sent to these specialized cells called mast cells, and those are located in the blood, gut, lungs, skin, nose, and mouth. And typically you think of it as anywhere next to the outside environment. So, your GI tract does that, your lungs, you inhale from that. So these mast cells increase blood flow. Whenever they're released, they release histamine, and they release blood flow to the site to get rid of the allergen. That's when everything swells and waters and is runny. So histamine travels and it targets, certain receptors, and then they act at the site of the allergen. So, but the cell membranes, whenever you have like a scratchy throat, like I know even with me, if I eat cheddar cheese, it's not like my throat closes off, but I do know that whenever as soon as I swallow that, I get a scratchy throat. That's a response. That's a very mild histamine response. But when someone's throat closes off, then that is, of course, a severe response, which is anaphylaxis. So what are some side effects that can happen? You can have low blood pressure, then high heart rate to compensate, and then you can have abdominal cramps, diarrhea, nausea, vomiting. Your lungs, you have difficulty breathing. You can have wheezing. Your airways just clamp down so you don't get enough oxygen. And then with your skin, you can have hives, flushing, swelling, and itching. So the mast cells, like I said, they are an important part of the immune response, and mainly in the GI tract and the lungs. And when they respond to certain substances, that's when the histamine is released. But mast cells are also involved in the following: defense against pathogens, which we talked about, like an invader, whether it's a bacteria or virus. You hear about mast cell activation with COVID-19, the cytokine storm. The mast cell activation is part of that cytokine storm. It's the inflammatory response. And then there's maintenance of the blood-brain barrier. It can actually happen in the brain. And with wound healing, mast cells are helpful to help you heal. So when you have too much histamine, you need an enzyme to break that down, and the term they use is DAO. It's diamine oxidase. So when someone's an alcoholic, they have a lot of, alcohol contains histamine, whether it's beer, wine, etc., that contains histamine, and then fermented vegetables contain histamine. So many times it's just the combination of the perfect storm. So you drink too much alcohol, you have a poor gut, your gut barrier is bad, and then you actually have too much histamine, and then you have watery eyes, runny nose, and then you can actually have an allergic response. And that's when a lot of people have food allergies, is because you can't clear histamine well. But that enzyme, diamine oxidase, or DAO, actually you can take supplementally twice a day. It's usually 8 milligrams. And that will actually lower the histamine response, whether it's hives, etc. So what's the difference between histamine intolerance versus allergies? Usually the histamine intolerance is more a body-wide system. Like say you're going to have, problems whenever you wheeze and you're short of breath, when you're stung by a wasp, a bunch of hornets, when you're out mowing the grass that come up out of the ground. That's a body-wide histamine intolerance, versus just allergies is just watery your nose, watery eyes, and maybe you're allergic to your cat that you don't want to get rid of because you love your cat. So those kind of things, that's more just a allergy response. So what are some treatments for that? Of course, if you have a severe reaction, you have to have epinephrine right away. So that's an EpiPen. So those are prescribed when you've had, say you've been stung by bees, and each time you get stung, that histamine response becomes worse, and then the primary care doctor typically prescribes an EpiPen. So as soon as you feel like you're getting short of breath after you're stung by a bee, you inject it into your leg, and it's epinephrine. So that actually helps calm down everything so you can breathe and you don't have that severe reaction. And there are some other things that we can use. There's histamine sites, like we said, in the stomach. And so some people use Pepcid AC, etc., because that blocks that. So if you go in the hospital and you have a severe reaction, you get hives everywhere, you can't breathe, then they're going to give you a histamine blocker because there are histamine sites in the stomach. Aspirin actually decreases the flushing, and that's by blocking prostaglandin D2. Steroids are given because of hives, wheezing, swelling, but they're usually used as the last resort. Then there's Zopinex, which is a leukotriene inhibitor, and that decreases wheezing, etc., in your lungs. Now, when I was a respiratory therapist, we used to nebulize Intol. Intol is a mast cell stabilizer. We used to do that. Now there's actually an injection that's given. It's called Xolair, and it's Xolair. This has been out for several years now, but basically it helps people with hives. It's one of the other reasons that you can negate those symptoms of having hives. One of the things that I prescribe is naltrexone. Naltrexone upregulates the immune system. And remember, part of this response is an immunomodulatory response. And this upregulates your immune system so that it kind of decreases the hives. That's a prescription that's compounded that we give. It's taken at night usually, and 4.5 milligrams is the typical dose. So a little bit about the diamine oxidase. That's the main enzyme, DAO, that breaks down histamine. And there are certain chemical influences that can inhibit its activity. Alcohol, like I said, beer, cheese, wine, meat, fish, those are all high histamine foods. Certain meds, antibiotics, such as macrolides and tetracycline, beta-lactams, they all can inhibit the histamine response. And then antihypertensives like ACE inhibitors. Somebody gets angioedema when you take an ACE inhibitor, and that's when your lips start swelling or you have facial swelling. That's a very serious thing that you need to go to the ER whenever that happens. So there's a couple other foods, mate tea, it's called, and theobromine, which is a compound in green tea. They can actually inhibit the DAO response. So one thing that you can do is actually take DAO. And it's like I said, it's 8 milligrams twice a day. So what do you do whenever you have this? First, fresh whole foods are the best source of a low histamine diet. Things that I said before that are high, alcohol, beer, wine, champagne, things that are fermented vegetables, meats, ham, salami, soy sauce, tempeh, fermented vegetables like kimchi, sauerkraut, pickles, spinach, tomatoes, ketchup, vinegar, Worcestershire sauce, yeast. Those all have high histamine. So what can you do? What are some things you can do besides taking an antihistamine? You can always take that at night if you're Benadryl, but that makes you drowsy. You can take, Claritin, Allegra, Zyrtec. Those all are antihistamines, longer acting. There's also a supplement, quercetin, and quercetin actually is it's here someplace. Quercetin actually is, you can take 450 milligrams twice a day, and that's an antiviral along with an anti-inflammatory. So some other foods that inhibit histamine are apples, berries, black tea, buckwheat, cherries, citrus fruits, kale, grapes, honey, onions, shallots, elderberry, ginkgo, and St. John's wort was another supplement. So why the histamine intolerance? Just because your body's overburdened with toxins, and that all happens through your liver. So what are the things that we do? We open the drainage funnel and get rid of toxins. So if you'd like to talk to me about maybe yourself or someone that you know that has hives and it's a high histamine response, then we can review all the past medical history as to what's going on and currently what their diet is, how they sleep, what their stress level is like. And that's another thing. With COVID, you have a lot of people are stressed, and stress actually causes hives too. A lot of people think of thyroid, your hypothyroid can cause hives. But I'd love to help you differentiate what we can do to get rid of the hives in your case, and just give me a call. Thanks a lot. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.